Hey YouTube, it's Marita, and welcome to another edition of the Nurse Lounge. In this edition, we're actually going to talk about some basically being a Black RN Part 3. Here we go. If you want to see what I'm talking about, stay tuned. Back. My name is Dr. Marita P. I'm a registered nurse. I'm an OB/GYN, well baby nursery nurse. I'm also a nurse educator. I've been a nurse for almost 17 years now. I am doctorally prepared and I teach at HBCU. So with that being said, we're actually going to step into part 3 of my being a nurse while being an RN while Black series. Okay. It's not per se a series because I've only did 2 videos on it, but every so often I kind of add to that series. If you want to see 1 and 2, I will have those linked at the end in the end screens. But before we go on, I want to go ahead and give this disclaimer. This video is not for everybody. So if you take issue with the issues that Black nurses have in nursing and you feel that you need to come on here and be negative or say, well, we deal with that too, this is not for you. This is just not for you. Now, if you are interested and want to know what we go through as a minority nurse, as minority nurses, and you want to be part of the solution and not part of the problem, then you need to stay on board and listen to the video so you can see the things that we go through so that you do not add to the issue, that you can be a person of solution, not be the problem that we have. So with that disclaimer being said, if you're here because you want to gain some knowledge, gain some insight, and maybe even provide us some insight as to why you possibly do the things that you do. Maybe. But if not, then we do not welcome your negativity. So what I want to talk about is 4 things today that I want to talk about, that if you are a Black, and I say Black RN, you know, but if you are a nurse period, it doesn't have to be a RN, it could be a LPN as well. If you are a LPN or RN who is Black, or you are in nursing school right now, or you want to know more about what it's going to be like once you become a nurse, this video is for you. If you have not seen 1 and 2, like I said, you will need to go back and watch those after this one, okay? But one of the first things I want to talk about is, number 1, that your skill set will always be questioned or undermined. So what do I mean by that? Number 1 is your skill set will always be questioned and undermined. Your ability to do anything in nursing is going to be questioned. So do you know how to do that? Do you really know how to do that? Or, you know, I don't know if this may be too challenging for you, or that requires someone to be a RN to do that. Okay, well, I am an RN, I can do that, you know, or whatever anybody's capable of doing, your skill set will always be questioned. So here's an example, and I've told this story before, in another video. So for instance, when my competency was questioned one time, and believe it or not, it was by a patient's mother who was a retired RN who was Black. The mother was Black, the patient was Black, the whole 9. Long story short of that was, I went in to offer my patient a Tdap vaccine, the tetanus, diphtheria, and pertussis vaccine that we offer all our moms upon discharge. You know, just to have their immunizations, vaccinations caught up to date, especially since they have a new baby. Anyway, I explained this process to the mom of the baby, and asked her, does she want it? I talked about the side effects and everything like that. And then her mother or grandmother to the baby says to me, or says to the white nurse who was in the room taking care of the baby at the time, is what she's saying correct? Is what I'm saying correct? And I looked at that mom, the grandmother, and I looked at the patient, and I looked at the nurse, the white nurse, and I just simply walked out the room. And on my way out, I said, you let me know if you decide you want the vaccine. As she was asking the other nurse, is what I'm saying correct, or what the side effects are, after I already had just stated them, that's what I mean by questioning your skill set or undermining you. That's exactly what she was doing. And this didn't come from another nurse. This came from a patient's mother who happens to be a nurse herself and who happens to be black. So in this particular situation, it can happen. It can come from your own people. Sometimes they're worse than your counterparts. So just be mindful of that. So that's an example of what it's like for your skill set to be questioned. Like, okay, you don't know whether I'm telling you the truth about what the side effects of this medication are or what the side effects of getting the vaccine would be. Like, I'm knowledgeable. I'm educated. I know. I've also had some who were looking at me in another situation where they're like, okay, are you capable of taking care of a baby? You look so young. I'm like, I have 4 kids of my own. I'm very capable of taking care of a baby, type of thing. They're like, oh, okay, well, we just didn't know if you were capable of taking care of a baby, because this is somebody who's younger than me, mind you. I'm 42 years old with 4 kids. 2 are adults, okay? And at that point of the question, though, maybe only one of them was an adult. But it was from someone who's my counterpart, someone who we just didn't know if you were able to take care of babies. Well, why do you think I'm here? Why am I functioning as a nursery nurse today if I couldn't take care of a baby? Well, we've just never seen anybody who looks like you take care of a baby before. Really? Okay. Well, wherever you come from, where there's no black people who do nursery, I'm the first one, I guess. So, people will undermine you, is what I mean. Number 2. Sometimes, or most of the times, you are given higher acuity patients compared to everybody else. Now, this right here is not exclusive to being a minority, but travelers and float nurse and PRN nurses get the same treatment. So that kind of goes for them as well. If you're a minority on a floor that has mostly another race of people in terms of nurses, you oftentimes will get the higher acuity patients if they don't divvy them up correctly. You as a nurse have the responsibility to say, okay, you know what? This patient load is not divided correctly or not divided fairly. We need to go ahead and redivide it. But I'm going to go ahead and get to where that's going to lead you when you do that here in just a minute. But I want to say that also travel nurses, they give you some of the worst patients, higher acuity patients. PRN nurses, they give you some of the worst patients as well. And sometimes even when you float to another unit, you floating and they give you some of the worst patients. Okay, well, if you ever want us to come back, you don't treat us the worst. Okay, so, but that's something you will see as well. They will give you the higher acuity patients so they don't have to deal with them. All while they sit there and undermine you and question your skill set. Number 3 is that people will think you everything but a registered nurse. So when you walk into the room and introduce, my name is Marita, I'll be taking care of you today. They think you are dietary. They think you are housekeeping. They think you may be an LPN at best. They think you're the tech. They think you everything but what you actually are. When you be sitting there with a big old RN badge on your badge, a lot of the badges will say, your picture and everything have RN somewhere on it. And they still think you that. Like, they don't even bother to read it. You will get a lot of that as well. So be mindful. You're going to see people who treat you accordingly to what they think you are, but not to what you really are. And then they'll say, when they find out you are the nurse, right? They'll say, maybe something has come up and, something happened and they're not happy about it. And they'll say to you, I want to see the charge nurse. And then you looking at them like, well, I am the charge nurse. How can I help you? And then they just blown away. They're kind of like, oh my gosh, and then all of a sudden they don't have an issue no more. Or they want to see somebody above you, of course. And so, you find all these issues, again, with being a black RN or a black nurse, that you are kind of like, okay, why is it that I can't be a nurse? Why do I have to be housekeeping? Why do I have to be just delegated to those kinds of roles? Nothing wrong with those roles. We need people in housekeeping. We need people in dietary. We need people who are the techs. We need all those people. But why do they have to look a certain kind of way? Why can't we all be those different kinds of people in those different roles? And that's some of the issues that you'll find too as being a black RN or a black nurse. The last one I want to talk about is microaggressions. Microaggressions are those little things that happen or are said or unspoken things that are basically almost myths, or things that, if they're not a myth, there's something that people will do or say to you that they think is appropriate, but actually is very inappropriate. So an example of a microaggression would be something along the lines of, oh, your name is Sanquisha. Can I call you something shorter? That name is too long. No, that's my name saying Quisha. That's what you're going to call me. That is a microaggression. Can I touch your hair? Or they don't even ask. They just come play in your head. And we're like, you don't do that to black people. We're not to be petted. We don't really take to that very well. Or that's a microaggression. Or another microaggression would be, you just seem so unapproachable. I'm the one who don't say nothing to nobody. So how am I unapproachable? I don't say nothing. I come in and do maybe because I don't say anything to anybody. I'm very quiet. If you ask me a question, I speak. And I'm not saying this is specific to me in terms of being unapproachable. These are the things that I've heard from other fellow nurses who are RNs who have had issues, who have been told me that they were deemed to be unapproachable. And they haven't did anything to warrant that other than the fact that they happen to be black. And that makes them unapproachable in itself. Sorry. So those are that. And one more I'm going to come up with. Let me see. One more would be, well, no, I'm going to end it there. I'm going to end it there. I'm going to save the next one for the next video. So if you happen to be enjoying these series of different kinds of videos, like I said, I come and do the Being the Black RN video every so often. And I do those videos because of the fact that I feel that people don't understand what we go through as minority nurses. And I'm here to tell it like it is. I don't have any qualms at all about being honest and transparent about my experiences or about experiences that other nurses who look like me have told me about. And so if anybody takes issues with what our experiences are, that is on you. That is not on us. And nobody will make us feel bad about what we experience because somebody is doing it to us. Now, as a disclaimer, if you're someone who is going out here being rude to other people and then you get what you get back because that's karma, I'm not talking about those kind of people. I'm talking about the ones who have done nothing wrong, who just for the sake of what they look like, they get treated differently than the counterparts. That's all this video is about. So if you go and start and stuff, so don't nobody come, well, if they start stuff, okay, no, we're not talking about those kind of people because no one should be starting anything with anybody, no matter what they look like. What I am saying is that sometimes we as minorities get the brunt end of things because of the fact of what we look like. They have no other reason. It's not our, we are knowledgeable. We have, oh, I know what I was going to say. Another one is when you have the same qualifications. And I may have mentioned this in another video, but you have the same qualifications as someone and you want a management position. And let's say, for instance, you have been in management before. You've been a nurse for, say, 10 years. You even have a master's degree. The position only requires a bachelor's degree. But yet somebody with an associate's degree who does not look like you, who has 2 years of experience, gets the job over you. That happens all the time. And I've seen that. Now that hasn't happened to me, but I have definitely seen that happen time and time again where someone who is more qualified did not get the position, and it was determined that it was because of what that person looked like, that they wanted, that the unit would not handle. The words were the unit would not handle well someone who looked like, someone who could not run the unit because of what they look like. That is common. And in case you all want to know, where do I live? I live in the South. I live in Tennessee. And Tennessee is very different than places that, or Middle Tennessee anyway. It's very different than places that where the demographic is different. So again, if you live in Atlanta, if you live in Detroit, if you live in Philadelphia, Chicago, places that are heavily populated with minorities, then this is not maybe a situation that you would endure. But places like where I live here in Middle Tennessee, where it's quite diverse, but we're still very much the minority, and we do experience these things. So again, there's no need to coming on here and say, well, I live in and we don't have that problem. Well, if you're all black, you won't have that problem. Okay, actually, you probably will have that problem because black people do it to themselves. So you probably do have the same problem because for whatever reason, we have issues with thinking that we compete against one another when we should all be bringing each other up. But that's another video for another day. But anyway, I just want to come talk about those 4 things that you will see, minority issues in nursing that you will see if you happen to be a minority in nursing. And this goes true for men or women at minorities. I'm speaking specifically of being black, but however, I'm sure there's other ethnic minority groups who endure the exact same thing. And it could be worse for them, I don't know. But that'd be interesting to find out. If you happen to like this kind of content, please thumbs this video up, like, subscribe, comment, share. Follow me on IG if you so choose. And until the next time, you all take care. Bye-bye.